Okay, I'm Nicole Rogert, and I am the founder of Mason's Light, which is a great thing, but unfortunately, we had to found something like that. And I'm open and ready to hear all of your questions. I'm an open book, and I'm ready to move things forward for these kids.
And hi, I'm Jenny Amann. I am the co-lead for the Nebraska Partnership for Mental Health Care Access in Pediatrics, or NEPMAP, at the Nebraska Department of Health and Human Services. Anna?
And I'm Anna Whaley. I am a parent member of the organization, and Jenny is so graciously letting me share her internet today.
Tori?
My name is Tori Sorensen, and I am a foster adoptive parent of 4 children, and didn't realize that delay turns into behavior. So kind of got thrown into the mental health world unexpectedly, but we're doing good things and helping the kids. I'm also a physical therapist.
Hi, everybody. Can you hear me? Hi, everyone. I'm Rachel Fox, and I am mom of 11 and founder of You Go Girl, a nonprofit organization in Omaha focused on empowering girls and women in our community. Glad to be here.
Welcome. Oh, and did you have something, Jenny?
No, I just am thrilled that we were able to participate in the AMCHP conference. And so thank you so much for having us.
Yeah, we are so excited to have you all and to hear both in the presentation and now in the live Q&A all of your expertise and lived experience. So just going to go ahead and kick us right off. I think leading into one of our first questions, but I think folks are just interested in hearing the logistics of NEPMAP and how you all operate and what that advisory group looks like in practice.
Sorry, I can't type Anna's name and talk at the same time. So NEPMAP is a program that it's a federal program administered by HRSA, the Health Services and Resources Administration, in the Pediatric Mental Health Care Access Grant. In 2018, DHHS, Nebraska DHHS was awarded the Pediatric Mental Health Care Access Grant, and my boss, who is also a co-lead, her name is Kathy Karstings from the Maternal Child Health Title V program at DHHS. We talked a lot about it and how we could make change. And, you know, there's a lot of ideas, but there are a lot of incredible people around the state who are already working on mental health care. And so it was a matter of, we need to put together a small advisory committee is what we had originally talked about. And she says, you know, 10 or 12 people that can allow us to make decisions and move this grant forward. And what happened was that after my 10 or 12 people, I kept getting more recommendations, more referrals. Hey, you can't do this without this person. Hey, have you talked to this person? Hey, did you go talk to these people? Oh, well, you really want these people. And at the core piece of it, it was not just the psychiatrists and the mental health care providers. We really wanted parent voice. You guys might laugh at me, but what happened is our small advisory group is over 70 members strong. We have representation from clinics and hospitals, professionals and schools. I have everything from a para in a classroom with special health care needs kids, and 10% of our group is made up of these parent voices. We hold the parent viewpoint, the parent perspective above everyone else. You know, one of the things that Anna could probably tell you too is that it's scary to go into a large group where you have PhDs and MDs and all these letters behind people's names, that it can be very intimidating. Nobody's going to want to hear my little story. But so we went into NEPMAP and we told people that from the beginning. In this room, we are not doctors and nurses and professionals. We are just Jenny and Anna and Rachel and Nicole. and that we were all here for a common purpose. We also start off all of our NetMap meetings with a parent story, with a perspective that grounds us to the reason we're there for those difficulties that we found. One of the greatest moments in this group, and I facilitate the group once a quarter, and one of the greatest moments I had is when they were early on talking about how to access care, what kind of programs are available, blah, 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 blah. This should be no problem. All you have to do is call this person. Oh, they've got this program. And one of our parent representatives, back then we were meeting in person, one of our parent representatives kind of made a snorty noise and looked down at her hands, and she said, "Oh, sure." And so I called her out and I said, you know what? I think that you're expressing that you have had a different experience. And she was brave enough to stand up and say, you guys might say that all of this is available, but that's not how it works. And she schooled an entire room of professionals that thought we were doing a pretty good job in what the realities were. And so I am incredibly proud of that. I'm incredibly proud of her. Our parent representatives have stayed on. And I think, just in our presentation, how I got Tori, she called me, and it was honestly, it wasn't even the right number to call it DHHS, but talking through there and wanting to help and wanting to get her to the right people. And then, hey, I really like how you were talking about this. And then she recommends, hey, you should talk to my friend Nicole. And so we got her in there too. And Rachel too. Tori has been absolutely instrumental in this. And it just snowballed, but it snowballed in a really beautiful way. So does that answer the question, or was that too much?
No, that was great. And I know in your beginning, I will say I really enjoyed in the presentation hearing, it seems like each one of you, every time you started talking about how you got connected to it, it was like, oh, well, it was just a string of community connections that seemed to have brought people to the group. And that was really incredible. And similarly to a comment that came in through the chat, as well as connecting to one on the platform, what you mentioned, it can be really intimidating and scary to come in as a parent and a parent leader and a community leader to coming into these advisory group spaces where you are with, clinicians or providers. And so folks had some questions. One of the questions in the chat was compensation for family leaders that participate in the advisory council. And then also like what other forms of support, childcare, or like you said, that level setting just in the group setting, do you do to really support and empower your parents to participate in this group?
I will say that it was from the very beginning, and my co-lead, Kathy Karsting, agreed with me, is that if we're asking parents to take away part of their working day, part away from their kids, away from all of these other things that they need and should be or could be doing, that they need to be paid for their time, and they need to be paid in a commensurate way. And so, yes, we have contracts with every one of our parent representatives that they are paid $25 an hour for participation. They were in person. We were having in-person meetings, but then when COVID hit, of course, everything went virtual. And honestly, it's a little easier. We've actually had a lot greater consistency in attendance virtually. So at this time, we don't have plans to move it back to an in-person meeting. But when we did, we were paying mileage. The state mileage rate is 56 cents per mile. So we were paying mileage to get there. Luckily for us, the parent providers did not have daycare needs. And they will tell you that even if they did, it's very difficult to arrange for childcare when you have a child with emotional and behavioral health needs. But we do respect our parent consultants above all. Now, this is where I want to ask Anna, and I want to ask Nicole and Tori, did that make a difference when you were asked to be on this board? Anna?
What, daycare?
No,
Or
it's
even-
being compensated. made a difference with how you were able to participate?
A little bit, but not really. I mean, it helped, but I would have participated anyway because I really felt that strongly about it.
Excuse me, but what state are y'all from again?
Nebraska.
Okay, thank you.
Yep. Tori?
Jenny, I just wanted to highlight, I came from the western end of Nebraska, and they call that outstate Nebraska. It's very rural. It's very far away from Omaha and Lincoln. And one of the great things about having a virtual meeting is there is no barrier to bringing those providers in to participate. And so that's been very valuable, and I think we'll see some growth there in the future. The payment is, I mean, that is helpful, and there are parents that won't be able to participate without that. That may not be my situation, but I can tell you that meant that I was important to the group. And also, I remember the first meeting I attended, and I'm sitting in here, and our pediatrician happened to be on the board, and what am I doing in this meeting? I don't even understand what this is for. And so one of the things that I did, and I think Nicole and Rachel will both agree, is as they came and joined meetings, I was on the direct message and I was explaining things to them so that they didn't feel that overwhelmed. I don't have any idea what's going on thing. Jenny's wonderful. She explains things, but she can't be everywhere.
I appreciate it. I appreciate it very much. Nicole?
I suppose the stipend does help. It was not a factor for me to participate or not. I am incredibly passionate about getting needed changes for families. I work in child welfare and have for a very long time, and I am now on the other side of the fence, or I'm on both sides of the fence still, but I know what it's like to be on the other side of the fence. And when every day I would say, why did God place this on my heart? Why did God place a situation in my life? What is the purpose of this? And the purpose of this, I had to go through hard things. My son had to go through hard things, so he and I can tackle this together. So the stipend, I'm sure, will be helpful. But I would have done it anyway. And Tori's right. With the first meeting I was on, I was like, oh my goodness, I don't even know what I'm doing. But when you live a time of your life where you've worked so hard and you feel so shamed by the very system that you work for, and then you had other people who were like, no shame here, and that you were valued, it was a much different feel. And so I really appreciate that.
Awesome. Rachel?
Yes, I can echo the sentiments of the others that have spoken, and saying that compensation, although nice, is not a deciding factor in whether to participate in this group. Oftentimes when you are approached, I know for me, when I'm approached to join specific initiatives, cost or compensation isn't even discussed. It's almost a given that you're volunteering your time, but acknowledging that I'm not only a nonprofit founder, I'm not only a leader in the community, but it's also worth my time to be compensated. So to have a group that acknowledges that off the bat, it is very refreshing, and it solidifies the commitment to be a part of something, because it also says they've invested something in you, so then you in turn can invest something into this group outside of your time.
Thank you all so much for those responses. I wanted to share some affirmation too from the chat. Anita says, these presentations have done so much to encourage my continued efforts to get our health departments to include children, youth, and parents in their plan development for programs that target them. Thank you so much. And we had a question from Linda. How do you handle the concerns that family partners may have regarding confidentiality of their lived experiences and that of their children? I'll just start with that, and then we have a follow-up.
I will say that we addressed this very early in the group, and we talked about confidentiality as a group of professionals. Many, well, all of them were used to being in professions, in schools and in clinics and in hospitals where confidentiality was an issue. I also tell parents that they don't ever have to share anything they don't want to share. I do share things about my family and our struggles as well. And I've never had a problem finding somebody to share what their experiences are. But even in this presentation, when we came into it and we're practicing, I said, I only want you to share what you think is necessary to get the message across. And knowing that they have that control, I think is a lot. What do you guys think? I'm going to ask Tori.
I'm actually typing some things in the chat as we all talk.
Sorry.
My ADHD, I guess. So one of my comments about confidentiality is, as I reached out for help with my child that was running away and we were having police called, and I wanted a safety room in my home so I could keep him safe. I wanted somebody to train me on how to restrain him because he needed it. You know, confidentiality kind of went out the window when the providers that you reach out for help to end up calling you into the hotline concerned about your abuse or neglect of your child. And so this group is completely different to be in a group of 70 people where they're state representatives, they're physicians, they're, I mean, high up medical people in our state system, and to not be judged, to be heard, to be understood. It's completely freeing because that's what we needed a long time ago, but there just wasn't a place for it because people didn't understand, they didn't have an answer, they didn't have help. And this group may not have those answers or help, but they're willing to come alongside of us and acknowledge the problem and work together to maybe find some solutions.
I would like to say for confidentiality, if someone would have done this 10 years ago or 12 years ago, I might not be having to do this. So I only share what I feel comfortable sharing because the truth is, yes, this is my life, but it's truly my son's story and he should be the teller of his story. And I don't want to put him out there for everyone to chit chat about. However, you know, there's some things that just have to be shared because people don't really understand the impact of the lack of services or the judgment that comes with asking for help or admitting to yourself, I have a lot of skill, I have a lot of knowledge, and I can't do it. What is wrong with me? You know, and sometimes there's just needs that everyone needs help sometimes, and there's no shame in that.
When at meetings and stuff, I never felt that confidentiality was an issue. We were all there for the same reason. And everyone understood pretty much what was said there, stayed there. So I never had any issues telling my children's stories. As long as I could handle saying it. I tend to cry really easy. So that was probably my biggest issue. But then there were times I didn't go to a whole lot of detail just for, you know, my son's sake, you know, like Nicole said, it's his story. But if I felt what I had to say would impact the people there to get my point across as to, you know, why we're there and the needs of the day, or anyway, the story I was trying to tell and the impact it needed to have, I felt okay, you know, telling. So I've never questioned the integrity of the committee and the group. So I've always felt comfortable telling my children's stories.
And it's all about relationship. Everything, when it comes down to it, is all about relationship. You know, even Rachel, she was talking about what she would want for the magic wand, and even through Reach Out and Read, it's all about increasing the touch points in relationship. And I'm sorry, Rachel, I shouldn't take that out of your mouth.
I just wanted to make a quick comment. We also know that Jenny has vetted everybody on this board. And so we can feel kind of confident that their hearts are in the right place. I think that gave me a lot of comfort as well. But Rachel, I see there's a question for you in the chat.
Yeah, there's a question. Sorry, we have a flood of questions coming through here now. Would love to hear from Rachel if she has any recommendations on how we can better meet the needs of families of color. And then just a comment that they loved the Reach Out and Read initiative that you all had throughout rural Nebraska, and if there's any other plans for another program like that or an adaptation.
Thank you for that. And excuse me, I'm just getting over this terrible cold flu bug. Not COVID, thank you, Lord. But and I took my test and it came out negative. I will say that You Go Girl has definitely partnered up with the Reach Out and Read program, but it is not the only reading enrichment program that we have going on, especially within the Douglas County community. So there's a lot of programs that are going on with WIC and other programs throughout the Department of Health and Human Services that are promoting reading and nurturing with care providers and children. You can't have enough reading enrichment programs, and I cannot stress enough how important it is to make sure that every child, every family has books that are theirs, that they don't have to give back, that they don't have fines associated with them because the child did not bring the book back and they can't pay for the fines. We've also had those come through where you can't get certain things done or you can't check out another book because you have all these different fines. And that is a challenge and an obstacle that other families have to face. One thing that I will say to better pull your arms around BIPOC families is to make sure the resources that you share specifically have and include those professionals that look like them, that represent them, and that understand them. I can't tell you how many times I have called mental health care providers or those types of places, and they don't have a mental health therapist available that is of color, that has a multicultural background, that addresses my child. When you are giving out these resources, sometimes we have to put on that empathetic hat, because sometimes our default looks like the default settings of an app. Go to any app that you want, and you have an emoji, and the emoji, the color, the skin color of it is yellow, and that represents the default color for everybody. But that we all know that that's not the case. So sometimes in different situations, especially when we're dealing with multicultural families, we have to put on a different lens, take off these glasses, put on these glasses. What might they need in this situation? And we all think we know that until we step into that person's shoes, and that is empathy. So start with that, and then your resources that you share will be that much more enriched. So I hope that answers your question. And we do have more things planned for our organization. We do coding clubs year round. We're getting ready to partner with a teen center to do a leadership development program for girls, where we're going to incentivize them by giving them money to actually do their own budgeting for the upcoming school year. So we're not just tackling social emotional, we're also putting that financial aspect and giving them the tools that they will need to be able to be successful in the years to come. So that's just a few things that we're doing with our organization. I'm happy to share other things, but I don't want to take up too much more time. But thank you for your question.